So you treat sleep apnea in your practice without using these CPAP devices. And as you say, CPAP works.
Yes, CPAP does work. But what I tell my patients is to consider alternative options. Now, CPAP has been, sleep apnea is the silent disease of our generation. Okay, it's a lot of people are affected. Some of them don't even know about it. Okay, they think that they're sleeping. They're chronic snorers. Okay, sometimes couples are not even sleeping in the same room. Okay. because of the noise, okay, of the CPAP machine, okay, or the snoring, okay. These people are not getting enough rest. There's research proves that about 60% of sleep apnea wearers who have a CPAP, they don't even use the CPAP machine.
They can't wear it.
They can't. It's non-compliant. They don't like it. They don't wear it.
Okay.
I had a patient who told me he puts his machine on and his wife jokes because he looks like Darth Vader.
Okay.
Okay. It's uncomfortable. It just wasn't working out for him. So we have an alternative where we make a custom-made device that pulls the jaw forward, opens up the airway, and all of a sudden you're breathing a lot better. Okay, no more CPAP. You can get rid of the machine. You're getting the same amount of oxygen. You're not a zombie anymore. You're not walking around all tired all day long. You're not cranky because you're getting rest.
Is this true? I mean, people with sleep apnea, they think they're sleeping, but they're not sleeping.
They're actually not sleeping. We have studies that show that sometimes people with sleep apnea, they actually stop breathing for more than a minute. More than a minute, Randy. You're not breathing for more than a minute. That is dangerous. That's the leading cause of stroke, heart disease, a bevy of other diseases that are like silently creeping up on you, okay? And you're not even aware of it, okay? And a simple mouthpiece that opens up the airway can fix all of those problems.
And they're sleeping again.
They're getting the rest. They're waking
and they're
up
back in the same room.
They're back in the same room. They're together. They're a couple again.
So who likes it the most? The
I think
partner?
The wife. I think the partners like it the most.
So the chronic snoring also?
The chronic snoring
you can
also,
work with
yes,
that too?
Absolutely. That is a sign that you've got sleep apnea. If you're a chronic snorer, you got to get a sleep study done right away and figure out what your blockage is. How much are you breathing and how much are you actually not breathing per night? Because that is an eye-opening number, Randy. When you look at that number and realize that, oh my God, I'm not breathing for a minute or two every night, every
like
10 or
every
15
hour,
minutes.
maybe?
Every hour, they stop breathing. They're literally dead on the bed for a minute or two every hour. And that is scary, Randy.
So that's why they wake up exhausted.
That's why they wake up exhausted.
So do you have patients that you make them this custom-made appliance and they wake up and they have more energy?
They're more cheerful. They're more happy. They can go about and they just feel a lot more energy throughout the day. They're awake.
Because we all know what it's like not to sleep. You feel
You're
lousy
tired.
the next
You're
day.
lethargic. You can't get any work done. You're not yourself anymore. It's like that Snickers ad.
Okay.
You're not yourself when you're not having your sleep apnea appliance.